Hello, I'm Dr. Carol Kollarits, one of the ophthalmologists here at the Eye Institute of Northwestern Ohio. I'm here to talk to you about cataract surgery. Now, the first thing I'd like you to know is that a cataract is not a growth over the front part of the eye. A cataract just means that the lens inside the eye, which is crystal clear in a healthy young eye, has become hazy with age. When it has become hazy enough that you notice difficulty with reading or driving or doing the things you want to see to do, that's the time to have cataract surgery. Now, the first thing that I want you to know about the surgery is that most of our patients say they had no pain at all during the surgery. We have a way of making the eye numb without using any needles around the eye. What we would like to accomplish in most cataract surgeries is to remove the hazy cataract but leave part of the capsule behind to support an intraocular lens implant. And this shows an eye with an intraocular lens implant with the capsule of the eye intact, holding the implant in position. The implants are made of several different materials and have many shapes and sizes. This is a general idea of what the implant looks like. The actual size of the implant is much smaller, though. Now, this is the ideal situation. As you know, with any type of surgery, it's always possible to have complications. And I'd like to discuss with you some of the potential complications. Perhaps the most common thing that we have happen isn't truly a complication. In 20% or more of our patients, the capsule that we deliberately leave in at the time of surgery becomes hazy over time. When that happens, we can use a neodymium YAG laser to make an opening in that capsule that will be clear and allow the eye to see clearly again. This is what is often referred to as laser treatment or neodymium YAG laser treatment of a secondary membrane or secondary cataract. The success rate of this procedure is very high, with complications only 1 in 1,000. Now, it's possible, of course, to have other types of complications during the surgery. It's possible, for example, to damage the cornea. And this is the clear watch glass over the front of the eye, and if this becomes cloudy after the cataract surgery, then it's possible that the eye might need a corneal transplant. It's possible to break this capsule during the surgery, and if that happens, that increases the risk that the eye would have infection, which could cause complete blindness, a retinal detachment, or cystoid macular edema. Those complications don't occur very often, but when they do, they may require additional surgery, and the eye may end up with not as good vision as we would like. Fortunately, they're not very common. Now, almost everyone will notice a little bit of glare, halos, or a little bit of difficulty with night vision following the cataract surgery. And that's because the implant itself is not quite as big as the natural lens inside the eye was. And in nighttime conditions, when the pupil is dilated, some light can get around the edges of the implant and cause these symptoms. In most people, those symptoms are less annoying than the symptoms they had at night when they had the cataract, but they might still be present. It's possible to have a droopy lid or double vision after the cataract surgery. Those things aren't nearly as common today as they were years ago when we used needles around the eye, but occasionally they still happen. Almost everybody notices a period of blurred vision, usually just for a few days. Often there will be floaters, and some mild discomfort is to be expected after the surgery, but not severe pain. It's occasionally possible that a piece or several pieces of the cataract could remain inside the eye, and that usually is treated just with eye drops, but occasionally that might require a second surgery to remove particles left behind. Again, all of these things are relatively uncommon, and most of our patients who have cataract surgery have a good result, have improved vision, and are happy they had it done. Most likely you will be happy too. I do want to mention to you that we have a new procedure available where we use a premium intraocular lens implant that is supposed to allow you to see clearly both in the distance and for near work. This requires an additional payment from you because your insurance will not cover the premium grade implant, and the payment is between $2,500 and $3,000 that your insurance would not cover. In addition, use of this particular implant will require additional post-operative visits and more medications than we ordinarily use following routine cataract surgery. Vision is usually very good, and even without the premium implant, many of our patients, maybe as many as 10 to 15%, actually see fairly well for reading and in the distance without glasses. In general, if you have the regular implant, you should expect to have good vision with bifocals. If you're interested in the premium implant upgrade, please talk to one of our technicians. Now I'm going to introduce Tana Walsh, our head nurse, who will talk to you about some of the things you need to know on the morning of surgery. Thank you.
Welcome to the Eye Institute. My name is Tana Walsh, and I'm one of the nurses here at the Eye Institute. Most of you have just had the opportunity to listen to Dr. Kollarits explain cataract surgery. I'd like to take a few minutes to share some additional information with you. And working together, we can make sure that the preparation and the surgery itself goes smoothly and is a positive experience for you. The first thing that I'd like you to do is have you call your family doctor and set up an appointment for a physical exam. We'll be giving you a form that I'd like you to take with you to your family doctor. Please have them fill this out and return it to us as soon as possible. On our part, we will be sending a letter to your family doctor from Dr. Kollarits. So make sure that we know the name of your doctor before you leave today. In this letter, Dr. Kollarits will notify your doctor that she is planning to do cataract surgery. And it asks your doctor to fill out this form and return it to us as well. The second thing that I need your help with is in providing us with a list of all the medications that you are currently taking, as well as any allergies. If there are some medications that you're not sure of the name, your family doctor can be a big help in providing you with the correct name and information. This information is important so that we can tell you which medications you should and should not take on the day of surgery or prior to surgery. The third thing that I need your help with in planning for your surgery is to make sure that you have someone to drive you here and to drive you home after the procedure. You should not drive yourself. If it's difficult to find someone to drive you, a friend or family member, on the day that you've chosen for surgery, please call us and we'll reschedule it to a date when you can have someone drive you. The reason this is so important is that occasionally on surgery day, we need to give you something to help you relax. Maybe you're a little more nervous than you thought you would be, or your blood pressure is a little higher than we'd like it to be before surgery, and we need to give you some medication. Often these types of medications affect your ability to drive safely. So it's important to have someone drive you to surgery and drive you home. We encourage you to have your driver, whether it's a friend or family member, stay here the entire time that you're with us. There's coffee and tea provided, magazines. We encourage you to bring something with you to read. If that's not possible and they need to leave and come back, it's important for us to have a telephone number where we can reach them. All of this information that I've provided you with is included on a pre-op instruction form that we will be sending you home with today. When you get home, sit down and take some time to read through those instructions. I know that we're giving you a lot of information at one time today, and that it's difficult to process so much new information sometimes. So take some time to read through that when you get home. And if you have any questions for us, please feel free to call at any time. We'll be happy to answer them for you. We look forward to seeing you on Surgery Day. Thank you for your attention.